Point 1. Persistent itching on the scalp, a silent signal of internal trouble. When most people think of scalp itching, they blame dandruff, dry skin, or poor hygiene. But after the age of 60, persistent or unexplained scalp itching can point to something much deeper. Doctors note that the scalp has a rich blood supply, and when something goes wrong inside the body, such as liver disease, kidney dysfunction, or blood circulation issues, the scalp often reacts first. For example, chronic liver problems like hepatitis or cirrhosis can cause bile salts to build up in the bloodstream. These salts get deposited in the skin and trigger intense itching, especially on the scalp and arms. Similarly, people with kidney disease may experience uremic pruritus, where waste products that the kidneys fail to remove circulate in the body and irritate the skin. A 68-year-old man once shared how he ignored scalp itching for over a year, thinking it was only dandruff. Later, tests revealed advanced liver disease. Had he acted earlier, treatment could have slowed the damage. What to watch for: itching that doesn't improve with shampoo or topical creams. Itching that worsens at night, yellowing of the eyes or skin jaundice. Unexplained fatigue or loss of appetite. Why this matters: if ignored, these underlying conditions can silently progress and shorten life expectancy. Seniors who recognize these signs early and consult doctors may extend both their lifespan and quality of life. Practical advice: don't dismiss persistent scalp itching after 60 as just dryness. Get regular liver and kidney function tests. Stay hydrated, avoid alcohol, and limit fatty foods to reduce internal strain. Use gentle, non-chemical shampoos, but remember, the root cause may not be external. Point 2. Itching on the lower legs and feet, the hidden danger of circulatory problems. Itchy lower legs and feet are extremely common in older adults, but when persistent, they often indicate serious vascular or metabolic issues. One of the most overlooked conditions linked to itchy legs is peripheral artery disease (PAD). When blood flow is restricted due to hardened or narrowed arteries, the skin of the legs may become dry, itchy, and flaky. Seniors may think it's just aging skin, but it could be a sign of reduced circulation, a major risk factor for stroke and heart attack. Another culprit is diabetes. High blood sugar damages nerves and blood vessels, leading to diabetic neuropathy and skin itching, especially on the feet. In fact, diabetic foot problems often begin with itching before progressing to ulcers or infections that can lead to amputations. One elderly woman described how she ignored itchy ankles for months until one day her skin broke open and an ulcer formed. She later discovered she had undiagnosed diabetes. What to watch for: constant itching around the ankles or calves, skin that feels tight, shiny, or thin. Numbness, tingling, or burning in the feet, wounds that heal slowly. Why this matters: poor circulation and diabetes both increase the risk of heart attack, stroke, and kidney failure. If untreated, itchy legs could be the first step toward life-threatening complications. Practical advice: get routine blood sugar and cholesterol checks. Walk daily to improve circulation. Avoid scratching, it may cause open wounds. Moisturize legs, but also monitor for color changes, swelling, or sores. Point 3. Itching on the back, the overlooked warning of cancer and nerve issues. Back itching is often brushed off as dryness or irritation from clothing. But in people over 60, chronic back itching with no visible rash can be a subtle sign of deeper issues. Dermatologists warn that skin cancers, such as melanoma or basal cell carcinoma, may begin as itchy patches or spots on the back. Since most seniors cannot easily see their back, these warning signs are often missed until the cancer progresses. Another hidden cause is nerve compression. Conditions like spinal arthritis, herniated discs, or even early Parkinson's disease can cause unusual nerve sensations, including itching, tingling, or burning. This is called neuropathic itch, and it does not improve with creams because the source is neurological, not skin-related. One 72-year-old gentleman complained of back itching for 2 years. He tried lotions, oils, even home remedies, but nothing helped. Eventually, an MRI revealed a pinched nerve in his spine. Surgery relieved the nerve pressure, and the itching disappeared. What to watch for: itching in the same spot repeatedly with no rash. Itching combined with numbness, tingling, or pain. Moles or spots on the back that change shape or color. Sudden unexplained weight loss. Why this matters. Back itching can be the earliest warning of cancer or nerve disease, both of which are life-shortening if ignored. Seniors often think, it's just my skin, but the truth is, the body may be whispering about something far more serious. Practical advice. Ask a loved one to check your back for moles or unusual spots monthly. If itching persists, request a full skin check from a dermatologist. If accompanied by pain or tingling, consult a neurologist. Don't cover it up with creams alone. Investigate the cause. Point 4. Itching around the chest and underarms, a hidden signal of heart or hormonal problems. Persistent itching on the chest or underarms in seniors can sometimes be linked to serious systemic issues. One major cause is heart disease. Poor circulation and buildup of toxins in the blood can cause chest area itching. Additionally, some heart medications, such as statins or beta blockers, can trigger allergic reactions, often showing up as chest or armpit itching before other symptoms appear. Another surprising cause is hormonal imbalance. After 60, both men and women experience changes in hormone levels. For women, postmenopause can bring thinning skin and hormonal rashes. For men, reduced testosterone can also affect skin sensitivity. Persistent chest itching could indicate thyroid disorders, adrenal issues, or even lymphoma. A 65-year-old woman shared how her underarm itching kept returning, no matter how often she bathed or changed soaps. Later, doctors discovered early-stage breast cancer, where itching was an early, but ignored symptom. What to watch for? Itching combined with chest pain, shortness of breath, or palpitations. Redness, swelling, or lumps in the underarm or chest area. Sudden night sweats, fever, or unexplained weight loss. Medication side effects that appear as skin irritation. Why this matters. Chest and underarm itching is often ignored or treated with powders and creams. But for seniors, it could be the body's way of flagging serious cardiovascular or cancer risks. Early action can prevent years of suffering and potentially extend life. Practical advice. Never dismiss itching in the chest area if it keeps returning. Get regular heart screenings and EKGs after 60. Monitor for lumps, bumps, or unusual skin changes. If on medication, review side effects with your doctor. Point 5. Itching on the palms of the hands, a warning of liver or gallbladder disease. When the palms of the hands itch persistently in older adults, it's not always about allergies or dry skin. Doctors explain that itching on the palms is strongly associated with liver and gallbladder problems, especially when bile flow is obstructed. This condition, known as cholestasis, happens when bile, the digestive fluid made by the liver, cannot flow properly. Instead, it builds up in the bloodstream, depositing bile salts into the skin, causing intense itching on the palms and solace. Sometimes, seniors with gallstones, hepatitis, fatty liver disease, or even liver cancer report itching long before pain develops. In fact, itchy palms can be one of the earliest red flags. One 70-year-old man ignored his itchy palms for years, assuming it was just dry skin. Later, he discovered advanced liver cirrhosis that had been silently progressing. What to watch for? Itching that worsens at night. Yellowish skin or eyes, jaundice, dark urine or pale stools. Abdominal swelling or discomfort. Why this matters. Persistent palm itching after 60 should never be dismissed. Liver and gallbladder issues, if untreated, can lead to liver failure or cancer, both of which drastically shorten lifespan. Practical advice. Get regular liver function and ultrasound checks. Limit alcohol, processed foods, and fried meals. Stay hydrated and maintain a balanced diet with fiber. Don't scratch excessively. It can break skin and cause infections. Point 6. Itching around the eyes or eyelids, a sign of systemic illness or blood disorders. Itchy eyes are often blamed on allergies or dryness. But when eyelid or eye area itching persists in seniors, it can indicate something much more dangerous. Ophthalmologists warn that chronic itching around the eyes may signal thyroid disease, blood disorders, or even certain cancers like lymphoma. Blood cancers, in particular, sometimes show up as unexplained skin itching long before other symptoms. Another common cause is cholesterol buildup. Yellowish itchy patches around the eyes, called xanthelasma, are linked to high cholesterol and a higher risk of heart attack and stroke. Seniors often dismiss these as just skin changes, but they are actually early cardiovascular warnings. One elderly woman shared how her eyelids kept itching and swelling. Eventually, she was diagnosed with Graves' disease, a thyroid disorder, something she would not have suspected without this subtle sign. What to watch for? Constant itching around the eyes, even with no allergies. Puffy eyelids, swelling, or skin changes near the eyes.